Welcome to the second meeting. To all of you who have been with us on the first time, welcome again. To any of you that may be the first time that you are with us today, welcome also. So today we are here to speak about precision oncology. This is our second meeting. I am Celia Diez de los Rios. I'm originally from Spain. And I am part of the steering committee of GPON, that is the Global Power of Oncology Nursing. And I'm also very recently been elected part of the FT3 board. So I'm representing the two organizations that are actually here today. Before we start, a little bit of housekeeping. So because many of us, our main language, it's not English, we have the possibility of you having translations. For you to have them, you may have it as in the image there. You may be able to see the CC, or you may be needed to press the three dots that say more. You need to choose as a speaking language always English, because it's the one that we are going to be speaking today. And then caption language, you put the one that is your mother tongue. So the one that you want to be reading as translation. If you do have any problem or any trouble with this, just write on the chat. We will do our best to help you. But we cannot set up the translation for you. So each of you will have to choose the language that you want to. Also, because we cannot see all of you and be in the same room, that it's a very nice way to do a meeting. But I will encourage you, as Masa just did, to say who you are, where you're from, okay? And in the meantime, I will speaking about what we are gonna do today. So of course, the first thing that I need to do is tell you who we are and who is gonna be speaking today. So they will introduce a little bit themselves afterwards, but I just want to welcome Darcy, who is in the US. She's an oncology clinical nurse specialist. Fatima from Nigeria, who is an oncology nurse. Liliana from Colombia, that also works in an investigation research and oncology hospital. And Halima, who is gonna speak today with us from Sudan. We also have a supporting myself, as you can see there, but also Silvia, Eleonora, and Osioma, who have very kindly been on the breaking rooms and will be part of the speaking and moderators today. So I already kind of asked you, please, let's talk to each other. We as GPON, the global community, we like to know who we are speaking with, who you are, where are you working? And also, if you came to the first one, or this is actually the first time that you are here listening to this. And while we are also doing that, I would like to ask you a couple of questions. First of all, how do you feel about the concept of precision oncology? And this is something that we asked the first time, but this may have changed since you started and since you came to the first session. So do you feel familiar with it? Not familiar at all? Extremely familiar? Just pop your answers. Okay, we're going to moderate very or extremely familiar. So it's good from the first session to now. It seems like we are becoming a little bit more familiarized with the concept of precision oncology. And we have some people that actually are not that familiar. I don't know if people can see the answers, but when I press finalize the votes, you will probably be able to see the answers.
Sally, I also see we get answers from the other questions. So if you scroll down,
so our second, oh, perfect. I can only see one. That's why I thought. Now I can see all of them. So our second question was about if you have received training or if you have delivered training. And there we have different answers. So delivered training, there is a general no, but you are interested in doing so. But it's amazing because that's exactly what we want. We want to learn and be able to share. And about receiving training, we have a mix, but most of you have done either self-learning or you have had access to it. So we would like actually that all of you have the possibility of sharing and learning, or maybe learning and sharing. So let's start a little bit speaking about who we are. So I already introduced myself as part of FT3 and part of GPON, but why these two organizations came together? So GPON, the Global Power of Oncology Nurses, we are a group that we try to promote that all of us have access to good education and good learning opportunities, and that we join as a community. At the same time, FT3, Eleonora will speak about FT3 in a minute, but it's an organization that is focused on making accessible and understandable precision oncology to every patient. Actually, not precision oncology, precision medicine. I always bring it to oncology because we are an oncology group now. So we were trying to understand what were the most unmet needs, especially on the patient community to start with. And while we were doing this, a little nurse like me came and said, actually, if you want patients to actually understand what is happening and what precision oncology is, you need nurses, because nurses are normally the ones that translate the concepts in an understandable language to the patients. So their FT3 offer to understand better what were their nurses' needs. And we had an overwhelming response from everyone in GPON saying that they wanted to speak about precision oncology, their needs, their challenges. And that's how we came together. So together we aim to understand that challenges, to improve this collaboration and the communication, and also to empower us to make a better, to have a better role, to empower the decision making so we can actually help patients to make an informed choice. And also, we will love, as GPON and FT3, to ensure that nurses have access to training, resources, and support. So we hope we are a start of a global community that we can help to make this something that it can be sustained without us, because we can all promote it in our own countries. So that's a little bit of how we came together. But we had a meeting, as I said, prior to this one, and we identified some of the challenges. And today we are focusing in one of the challenges, that is educational needs. So we try to put here a little bit of the journey that Eleonora is going to explain to us. So I'm going to give the floor to Eleonora, and I'm going to mute myself.
Thank you so much, Celia. So, Celia, you've introduced this perfectly. We just wanted to make sure that everyone could be on board with the journey that we took together so far and what led us here today. So as Celia mentioned, as FT3, we are a multi-stakeholder group that is dedicated to to ensure that every patient can access the right testing and treatment at the right time. And so we work a lot in the space of precision medicine, and we've run a few initiatives within the space of precision oncology specifically. As you may know, this is one of the fields where precision medicine is mostly developed. And when mapping out the care pathway and how does a precision oncology care pathway looks like, who are the different healthcare professionals involved, who interacts with the patient, who can really have an impact on the care journey of the patient, we realized that nurses play a pivotal role in precision medicine, yet they're often underrepresented or under-recognized. And so thanks to the big impulse of Celia, we decided to actually go deeper into nurses' needs. And so from a broader landscape mapping, we went deeper into understanding nurses' needs. And that's where we started to get in touch with a few of you. So thanks to your insights, thanks to a few interviews, we were able to go deeper into what are the needs of nurses. And the initial insights were also presented at ESMO last year, thanks to Celia again. And then we realized that the nursing community had an overwhelming response, and that also happened thanks to the availability of GPON to eventually start engaging with the nurses community, and that's how we ended up partnering together. Parallelly, we also always keep in mind the patient perspectives, and we also always strive to make sure that whatever solution we design, whatever space we design, it always has as a final outcome a patient-centered care. And so we also took a step a month ago and tried to go back to the patient community and engage with the patient community and with the multi-stakeholder group to understand, based on healthcare professional challenges, how could we support meeting the needs of patient better? What are their expectations, and how could nurses and pathologists in particular support patient care? So you just find images, but we will make sure to share with you all the insights that we've gathered so far. And then we worked on creating a platform for nurses, as Celia just mentioned. And that is something that we are very excited about and that we plan to keep on continuing, building on our inaugural session. Our inaugural session happened in December, engaging loads of members from the GPON community and engaging members from the global nursing community with GPON as well. Our objective, as Celia introduced, was to map out from you what are the key challenges that you think are hindering the possibility of nurses of feeling empowered and playing the pivotal role that they actually have within the care pathway to support their patients. And so from this first workshop, we could come up with 10 top priorities for the global nursing community. So here you can find just a very simple list of what we've heard from you. Again, this is just for presentation purposes, and you can expect us to share deeper insights into the session outputs, so stay tuned. Listening to your needs and to your insights, we then thought that it may be useful to design spaces that allow us to go deeper into each of these challenges and move from challenges to solutions by listening to people from the community, listening to good case practices, and then brainstorming together on how we can all collectively learn from these good case practices and what are gaps that we still see in the ecosystem, and how can we join efforts as a global community to eventually fill those gaps. So today we're going to focus on education and training, as I just mentioned. And we've heard there are very diverse needs and opportunities. I also would like to mention we were amazed by the overwhelming response, even in the registration form, of how many people shared the importance of the topic, how excited they were to attend, and how much you would also like to share your story. So I will now give back the word to Celia, who will help us get a glimpse of a few good case practices starting from our speakers. But then please feel free to share your story as well. This is really your space, and these spaces are designed for you as a global nursing community. So please feel free to let us know how we can shape that better, and make sure to speak up if you'd like to. So Celia, the floor is yours again.
Thank you, Leonora, for this very good overview of all what we have been doing. So actually, Eleonora gave me the floor back to actually give the floor to our four wonderful speakers. But as she just said, if you are interested in sharing your story, either by writing, if you don't feel comfortable, but remember that you can always speak here. We always speak by English. None of us are English our first language. So if you want to share your story, please let us know on the chat or write it, or actually after our four speakers, we will give you the floor if you want to share your story. So I'm going to start by introducing you to Fatima Adam, Senior Oncology Nurse, Federal Teaching Hospital in Nigeria, who is going to tell us a little bit of her education experience. Fatima, the floor is yours.
Hi, good day, everyone. It's nice meeting you all. I'm Fatima Adam, a senior oncology nurse from the Federal Teaching Hospital, Katsina, and I'm also the vice president of the Oncology Nursing Society of Nigeria. So it's nice meeting you. So as we all know, oncology nursing is evolving rapidly, especially with precision medicine, which is a personalized approach to cancer care. Cancer care shouldn't be a general care. We believe it should be a personalized care. It should be an individualized care. It should be an holistic care based on individual genetics and what have you. So, and nurses must continuously learn to provide optimal care. The learning shouldn't stop just because you're an oncology nurse or you are a trained nurse. Okay, you have experience. You should keep learning so that you meet up with the international standard. So addressing barriers in education is key to improving cancer outcome, as we all know. Next. So my oncology nursing journey started in pediatric units. My journey started in the pediatric neonatal unit, as the SCBU or the NICU. So then I just realized I needed something, I needed a general nursing specialty, something that that doesn't have any bias, that doesn't bias, no age differences, something that is general. I don't have to restrict myself to either caring for the kids or caring for the adults. I want something that won't restrict me, either age by age or sex. So that's why I thought of oncology. So, because as we all know, cancer does not discriminate. It doesn't discriminate based on your age, your sex, your gender, nationality, or any other thing. So being the pioneer and the senior oncology nurse in my facility, we started with just 2 oncology nurses, myself and a colleague. So that was we graduated in 2021. The journey started in 2019, but eventually, due to COVID, we finished up in 2021 from the National Hospital Abuja, which was the only oncology center in the whole of Nigeria as at then. So after graduation, with just 2 oncology nurses, it was tedious, but we have to take up everything possible. Managing cancer care, we started negotiating with other departments, although we are in the hematology unit, but we know we don't have to deal with only solid cancers. The liquid cancers are there in the hematology unit being properly cared for by their doctors, but solid cancers are on the ward, and we needed to step up to help cater for this patient. So we have to liaise with the hematologist team to allow us bring in the solid cancers as well, just to come receive their chemotherapy. We are trained, so we should cater for these patients properly. So we had liaised with them, and they don't want to lose the oncology nurses they have. So we brought in our solid cancer patients. That was how the hematology suite become the chemotherapy suite as at then. And from there, we move on. We started getting other people to work with us. Now we have pharmacists. We have not even 3, 4, 5. We have a lot of oncology pharmacists. But as at then, we were the pharmacists, we constitute, we do everything necessary just to make sure we cater for our patients. And from then, seeing the passion in us, we never relent. The management noticed this, and they bring a lot of their patients in. The cancer patients increased since then. And now we have 26 trained oncology nurses in Katsina State. And I believe that's the highest in the whole of Nigeria. There's no facility that can have up to that number of oncology nurses. So, and the department is taking shape. So that's within 3 years, from 22 to 26 or so oncology nurses. If the pioneers are not on their feet, I don't believe we get there. So although there are challenges, a lot of challenges came up due to limited training and access to advanced therapies, but we did not stop moving. So, and ever since then, I discovered the importance of continuous learning and advocacy. I never stopped upgrading my knowledge, a lot of trainings, BBGH, and presently now I'm one of the, let me say, a student or an intern, a senior intern at the NSIA, is the best cancer center in Nigeria. So I leave Katsina to Lagos State to go and still upgrade my knowledge. So let's go to the next slide. So why training is never enough? I believe even being an oncology nurse, updating my knowledge every time, training is still never enough. Why? Because oncology treatment evolves rapidly. Before oncology treatment, the only thing we used to know about oncology treatment is let me say, the original treatment, the old treatment known as chemotherapy. Apart from chemotherapy, is only chemotherapy, surgery, and radiotherapy. That's what people, once you say cancer, what people think of is chemotherapy. But now the treatment evolves rapidly. We have a lot of other treatments coming up. We have the targeted therapy, immunotherapy, and the precision therapy. We are talking about precision medicine, which is precision oncology. That should be an individualized care. General chemotherapy, as in cancer care, shouldn't be general. It should be an holistic care. It should be an individual care. So, and nurses must understand biomarker testing. If you want to know what precision medicine is all about, you must know how the precision medicine comes about. you must understand biochemical testing, targeted therapy, administration, and the side effects. Is when you know all these things that you can render the possible care, the necessary care to your patients. And apart from that, the high cost and limited availability of precision oncology drugs in Nigeria, it highlights the gaps in training and accessibility of treatment. Myself as an oncology nurse, I'm a trained oncology nurse, but I can say I don't come in contact with these drugs every time. Why? Because the cost of the drug is high and most of our patients are paying from their pockets. So for a ordinary, an average worker earning maybe 200 to 300,000 to purchase all these precision drugs, all these immunotherapies and targeted therapy drugs, it's on the eye side. Let's take trastuzumab, for example, used for the HER2 positive breast cancers. Trastuzumab in Nigeria costs not less than 400 to 1 million, which is 3 weekly. So for someone earning 200,000, I don't know how the person will go about that. You're earning 200,000 per month and you have to purchase a drug worth 400 plus 3 weekly. So, and bevacizumab also, it's 700 to 1.5 million. So a lot of things. And Keytruda, I must say, maybe I'm just saying Keytruda for maybe 2 or 3 times since I started practicing as an oncology nurse because of the cost. So even when you are trained and the drug is too expensive, patients can't afford it. Most of our patients, the liquid patients in cancers, when you prescribe R-CHOP, that is rituximab and CHOP for them, most of them can't afford the rituximab. They would rather go for the CHOP only. So just because of the cost of those drugs. So let's go to the next slide. So precision oncology in Nigeria of today. The training gap for nurses, generally precision oncology for the general cancer settings, there's limited access to genomic testing and precision medicine tools because not all facilities have these tools to it's only when you can do all these tests that you know, okay, this the patient you do immunohistochemistry, okay, the patient is the cancer is HER2 positive, okay, this patient will benefit from Herceptin. So when there's no such tool, you can't prescribe such drug for the patient, even if the patient will benefit from it. And the high cost, as I earlier said, not only the therapies, the drugs are expensive, the investigation too is another thing. If a patient is earning 200,000 and you are to do investigations worth 100,000 plus, so where will this patient get the money for the therapy? And there are lack of trained specialists in precision oncology. Although I'm an oncology nurse, I don't have any other special training based on precision oncology. So, but from school, as in I have some training, but not specifically based on precision oncology. So, and there's also need for policy supports. You have to integrate precision medicine into standard care, standard.
Am I the only one who just lost? Okay, so she will come back. But in the meantime, I'm just gonna give the floor to our next speaker. So in the interest of time and to allow Fatima to come back, as we will have her on the discussion afterwards, because she was getting into interesting part that is the strengths and the strength and solutions. But I'm gonna give the floor to Halima, oncology and palliative care nurse coming from Sudan. So Halima, the floor is yours.
Hello, everyone. I'm Halima from Sudan. It is a privilege for me to be in this program and with nurses, and especially oncology nurses. The oncology nurses in Sudan and all over need a lot of attention. And this effort is, I think, it is a global effort. And I think we can do something. Okay, we can do something in this program. Next slide. As I am a nurse working in the oncology, You know that our program in undergraduate, we have little about oncology or cancer. This is the basic. And when we start to work in National Cancer Institute with cancer patient, we face with a lot of problem, physical, psychological, social, and we are a general nurse. We graduate as a general nurse working in another department. There is no training for basic nursing. And at the end of the day, we go with suffering from patient, because just we give him injection. We have nothing to do for them. And this is really made us feel harm, and I feel I am nothing, we are nothing, I don't support this patient. For that reason, I start to train myself, because I think this is a solution for all nurses. If there is like our country limited resources, we start to do this training. At that time, I participate in distant learning for cancer patient in 2010 to 2011 for 1 year. And I start to train nurses on this year. What I learned in this course for 1 year, I train the nurses. The course is about 3 modules: child cancer, palliative care, and wound care. And also during this time, and I attend the first regional palliative care at Kuwait. Also, it add a lot of information for me, and I transfer this all information with session and in-service training for our nurses. Also, 5-day placement in UK. And also, I attend the Hospice Africa Uganda International Program. All this equipped me with knowledge, skills, which is comprehensive, and I start to train the nurses and for the comprehensive holistic approach, treatment, and patient-centered care. And also in 2024, I finished my fellowship program in palliative care. During these phases are interconnected together. I conduct me and our colleague a lot of training for the nurses, because we know that all these nurses don't know, and they suffer what we are suffer before, and we start to do this training for nurses. For example, wound care or colostomy care, we start to transfer the traditional wound care to the holistic approach, to patient-centered approach, okay? And in colostomy care and in radiotherapy, skin reaction, and also in palliative training for nurses, for all nurses in National Cancer Institute. Also establish home care, because we know that the patient after discharge, they come back with a difficult situation, because we have no any community nurses, we have no home care. And in 2017, we start the home care and volunteer program. Okay.
That's wonderful.
And phase 3, we continue, and I said this is all are integrated or connected, these phases. We start in 2000, maybe 13, to do a lecture for the undergraduate nurse, because this is a problem which I faced before. And I start to give him full information about oncology, about palliative care, about holistic approach, about patient-centered care. And also, I start to do clinical placement in the oncology center, because before that, there is no any clinical training for the undergraduate student. Me and my colleague, some of my colleagues, we do this program for the undergraduate. And this it have good outcome when these nurses are graduated. They came with a good knowledge and practice. We didn't suffer what we suffered before. Training and supervision how to conduct research in nursing, especially in oncology, because before that no one come to do anything in oncology for the student undergraduate student who want to graduate. They have project research. Most of them they do in palliative care, they in leukemia, in mother of cancer, in prescriptive of nurses and so on. And I aid him in conducting this research. Training oncology nurse and for Sudan Center, as I said before, after 2023, the start of the war, we displaced from our cities. All the oncology center closed in Sudan. The patient are suffer. We come to Sudan, it is a safe area, and we start another program, which is a hospice nursing clinic. During this period, we train about a lot of people, nurses, and also we start with oncology center. We train the staff of oncology center about palliative care, about home care, about end-of-life care. Also, we train we train volunteers to continue the care for patients in their home. And also we have home care. We go and visit the patient in their home to provide this care. Thank you for your attention.
Thank you for your wonderful story, and it's a story that you can see how much work you did and then stop because of problematic political issues. I think there's gonna be a lot of discussion afterwards, but I'm gonna give the floor now to Darcy, who is gonna speak to us also to some accessible education that they have online on ONS. So Darcy, the floor is yours.
Thank you, Celia, and thank you for inviting me to present at today's program. I'm just amazed and in awe of my colleagues and all the work that they're doing. It's, to me, you know, we're all trying to do the same thing, provide education to our patients to ensure they get the best care possible. I have the pleasure of talking a little bit about some of the amazing resources that are available through the Oncology Nursing Society on Precision Oncology. Next slide, please. The biomarker database is one of the resources that is available for nurses to obtain education on genomics. It was developed by nurses for nurses as an education and clinical decision support tool to provide information regarding the different therapeutic options for certain cancers, as well as clinical information about the associated biomarkers, as well as facilitate education, but by providing resources for oncology nurses to educate their patients on treatment options. However, it does not perform patient-specific analysis or provide any treatment recommendations. Currently, there are 363 biomarkers in 23 different cancer sites within the database. With the rapid evolution and advances of biomarkers, the content is reviewed annually. And as new targeted therapies are approved by the FDA, as well as new biomarkers become actionable in practice, we update the database to be current. So that's why I say it's a living document. In addition to the database, another resource that is available for you to access is the Genomics and Precision Oncology Learning Library, which houses podcasts, articles, different clinical practice resources, as well as patient education information. Both of them are free for you to access. You just have to enter your email address. Next slide, please. This is an example of the biomarker database. So what you would do is just search for ONS biomarker database, whatever search engine you use. And if not, you can just enter that into your address bar, ons.org. The first thing that you will see is at the top of this screen where it says clinical tools, biomarker database. And after you click on that, it'll take you to this screen where it says register to access this page. And then I'll just take you to the next page, or the next slide, please. And this is the learning library. Similarly, you access it by logging on to ons.org. And in this instance, you'll click on Education Hub and then Learning Libraries, and then you select the Genomic and Precision Oncology Learning Library. And this is all of the resources that are available to you. And if I can, I'm just going to share my screen so I can just let you see how this looks, if that's possible. So I'll go ahead and do that right now. Okay, so I'll share this with all of you. So I'll just put that up there. This is what the biomarker database looks like when you access it after you enter your email. You can put drop-down screen for any cancer site you're looking for, or if there's a cancer subtype, such as biliary tract cancers you want to look at, or if you're interested in knowing more about a targeted therapy. And what Fatima mentioned, pembrolizumab, maybe you want to click on pembrolizumab and see what other biomarkers pembrolizumab is active for. You would go through that. And then I'm just going to click on one of the biomarkers. I'll just click, CD19. And so when you do that, it'll bring this up. It tells you a little bit about CD19, what the implications for patient care are. We know it's a diagnostic biomarker. It's also a predictive biomarker. Here are the targeted therapies that are available to treat this particular biomarker. Also patient education that's available. You can click on that as well. How you should perform testing. Here it says at diagnosis after induction therapy. You can use testing is done using flow cytometry or PCR or IHC. Some other additional considerations, as well as clinical trials and related links, as well as the references that are available that help support this document. As I mentioned, we update this on a regular basis. So next is just going to briefly show you, this is the Genomics and Precision Oncology Learning Library that lists many resources that are available. You can just click on the plus sign, takes you to resources you can share with your patients, takes you to different videos that you can increase your learning or share with your colleagues. There's courses that are available, podcasts, videos, huddle cards that talk to you a little bit about the testing methods, what is, how to refer somebody for, genomic testing. So these are just some other huddle cards that you can just download for free. So any of these are available for free for just to enter your email address. It is in English, so that's the one thing. So, but hope that you will all take advantage of this great resource, and thank you for your attention. So I'll just stop sharing my screen.
Thank you so much, Darcy. And she already knows that I'm going to say the only problem is that it's in English. But, nowadays we have AI. So hopefully all of us can translate and use it in our resources. But thank you so much for telling us about this amazing resource. And I'm going to give the floor to our last official speaker, because I had some volunteers on the chat. That is Liliana, an oncology nurse doing an amazing work in Colombia, who has also collaborated with Darcy on these ONS biomarkers.
Thank you so much, Celia, and all the members for this invitation. Celia already did a small introduction. Next, please. So I just want to share with you a little bit of my background. I'm an oncology nurse here in Bogota, Colombia. I've been working with patients like 10 years ago with cancer patients, and I've been working in several areas: radiation therapy, navigation, infusion room, bone marrow transplant unit. Sorry, and now I'm working on clinical research. So my main role is a clinical research coordinator for early phase trials in oncology, but I'm also part of the Research and Education Institute here at CETIC. CETIC is a hospital, is a comprehensive center of cancer in Bogota. Is new. It just opened doors on July 2022. And I've been supporting the research teams, and I believe that's one of the keys that I want to give you as part of multidisciplinary teams to develop research. I also am a member of a couple of associations that gave me the opportunity to meet great professionals and to interact with people that taught me a lot, and to be part of the biomarker database with Darcy. Next, please. So why I'm into precision oncology? Well, I'm part of a multidisciplinary team in research, and one of my leaders is an oncologist that is very known here in Colombia and in Latin America for his research. He's an oncologist, and he's been guided me into this precision oncology, the importance of knowing, especially because in our education, in our basic education as nurses, and in a master's or in another programs focusing on oncology, we have experience with these topics, but we are not involved. And when we are face to face with a patient, it's important to know what we are talking with the patient, and what is the precision medicine, because probably this happens to all of us with patients. We have in the same room two patients with lung cancer, but each of them are receiving a different treatment. So they asked me why he's receiving this and why I'm not receiving this medication. So that is the importance of telling them, okay, this is precision medicine. This is because this is your kind of lung cancer is different from his or from hers. So that is one of the things that I believe is key. So I started training with a platform that is called Genotipia. And this Genotipia platform offers this genomic medicine in oncology and clinical applications in cancer. So I do this training. It was online, it was in Spanish. That was a great advantage because most of the resources are in English. Also, as part of my journey is be part of multidisciplinary teams. I work with genetists, with oncologists, with nurses, psychologists. So I realized about the importance of being involved in a team, because sometimes clinical research is really is focused only in outcomes, in progression-free survival, and the overall rates of adverse events, but some of them are not focused, for example, in the experience of the patient. So that is where nurses came in, because we know how to deal or to explain to a patient that is part, for example, of a clinical trial, and explaining them and guiding them through the journey. So I believe that nurses are a main part and very important part of these multidisciplinary teams in research. And also academic training for the nurses. Here at CETIC, I also work with education. And one of the things that we've been doing is that every year we have symposiums that are for nurses and for doctors. They are free. We invite international speakers. We have guests that share with us the latest findings of the trials. And these education opportunities are free for all the people that wants to join online or wants to come to our facilities. Next. So what are the results of all of these things that I share with you? Well, we have also a platform that we want to implement here in Latin America, and I believe that this could be also a tool for low middle income countries, and it's the increase proposal. We just reunite with nurses of different areas, with doctors, with psychologists, public health, government, insurance areas, and we detected challenges that face oncology nurses here in Colombia. And I believe that these challenges are not only faced here. We have lack of time for research, the payment is not adequate, we have overload of work, we have lack of training in tools for research and and even language could be a barrier. So what we do for proposals that we want to share with all the associations in Latin America to increase the knowledge and the role of the oncology nurses in clinical teams. So the first phase was to do the proposal. Now we are in the second phase, that is start working with the countries and with the associations to share this platform. And I work as a volunteer in the ONS biomarker database. I work specifically in the pancreatic database. It was really challenging because, as Celia says, the language is a barrier, but however, with all the artificial intelligence we have, it's become easier to understand, to translate into Spanish. And this tool provide me and sent me to share and to look for the latest evidence to have updated this biomarker database. The database is also, has a lot of tumors, and is actually very easy to read, and is a way, a brief way to understand and maybe to teach to a patient. And so I believe this tool could be also later translate maybe in words that can be understood by patients. And of course, with a collaboration, I believe that this is one of my calls to action in this session, is being part of associations. I had the opportunity and was lucky of meeting Celia, knowing the GPON, but also we have associations that I believe this is a key and is the most important for strengthening oncology nursing in precision oncology and in precision medicine. Next. So just the brief messages I wanted to give you: to improve collaborations with all healthcare professionals. We can learn a lot from our partners, from psychologists, from other nurses, from doctors. So it's important that also academics, the academia nurses are involved also in research, because, for example, in Colombia, it's very common that academics works in their research projects, and the clinicians, nurses goes through a different way. So the idea is to join forces to have better outcomes. Of course, increase participation of nurses in research, and spread the knowledge for low and middle income countries. Thank you so much.
Thank you so much, Liliana. Actually, the pleasure was mine meeting you. It's really nice to meet other people from other countries doing amazing things. So thank you officially to the 4 speakers for all the time that you have taken to speak to me and speak with FT3 and prepare this work. If anybody have a question, please do prepare them. But in the meantime, I would like to invite, if it's available, and please apologize if I'm not saying correctly, but Nana Hikmat was a person who expressed interest on sharing the story. So I don't know if it's in the call at the moment and want to tell us.
Yeah. Thank you very much. I'm
Thank
here.
you.
I'm right here, live. Yes, nice to meet you all, wonderful ladies who are doing great things to ensure that oncology nursing all over the world, is up to date in relation to precision medicine. My name is Nana Hawalawal. I am first I'm a nurse, and then I became an oncology nurse so many years ago, over 25 years now. I've been in the oncology nursing field. In some years, like a few years back, like maybe in, let me say, like 10, 15 years ago, we have had opportunity to work with great mentors who are oncology inclined nurses, whom we have together, been managing oncology patients for over 25 years together. And they have been a very big inspiration who have really motivated me to become who I am today as an oncology nurse. For me, our experience in terms of precision oncology nursing is just is a baby, is a new, a new innovation in terms of precision oncology nursing in this part of the world, in Nigeria, where we find ourselves. The only school of oncology nursing we have, the first one we have that was accredited by our Nursing and Midwifery Council, is the one that coordinating right now. It's in Abuja. Even the speaker, with due respect to her, Fatima, was my student. And today I'm really proud to have her here speak, putting forward what, we've impacted in them. And we've always said learning, we are lifelong learners. We must continue to learn so that we can meet up with the recent trend. And I'm really proud of her being part of this speakers here today. So in terms of precision oncology nursing in this part of the world, like she has actually said everything. I was just going to put an icing on the cake. Yes, in terms of education, being that I'm in the education aspect, I train nurses to become oncology nurses. I believe that we have a lot to benefit from this gathering. And I must also mention one of my strong mentors who had mentored me through my MSc oncology nursing, in person of Professor Mag Fitch. She's a Canadian, and she's a renowned author who has really impacted my life and has really mentored me and has really been a part of my success story. She is right now, she still continues to impact in us. She has taught us to be resilient and continue to study, because we need to, make sure that oncology nurse is not left behind in this part of the world. So I would just like to mention a few points where I think we can also, be able to achieve strengthening this, the theme of this discussion. For me, one of the things I look at in advancing solutions, strengthening nurses' education in precision oncology, my focus is on, one, enhancing oncology nursing curriculum, because you cannot have nurses become precision nurses without being, guided with a curriculum that will be with molecular oncology, targeted therapy, and immunotherapy into the educational system. They call faculty, our faculty in training, we are really in need of a lot of resources, not just human, not just education resources. We also need some of those material resources that can, empower us as educators to be able to put forward and teach people the right and the best practices in terms of precision medicine. So we will need to update our knowledge on precision oncology and innovative teaching methods. And then we also need to improve our hands-on training and clinical exposure, which will help in strengthening collaboration with cancer centers, like research centers, like some of you are coming from different cancer centers. Furthermore, we can actually do more together. And then one of the things we actually are going to be doing after this is advocacy. Advocacy and policy development is very, very crucial. Without policies, without advocating for these policies, we can never get forward. So we plan to go to our regulatory bodies, that's the Nigerian Nursing and Midwifery Council of Nigeria, and see how we can, integrate a few stakeholders Some of you may be invited to be part of the future communications. Then expanding continuing education is what we need to do, and certification, so that people will feel, yes, we're empowered and we can actually do this. Thank you very much for this opportunity to share my little story, but I still look that we can do a lot in future. Thank you so much, Celia and others.
Thank you.
Really
and
awesome.
it's amazing because when Fatima dropped on the call, a lot of the points that she was not able to share, and we were saying, oh, these were really good points. Actually, you made the same point. So you can see there, where is the mentor and the student speaking about the same things. This is really nice. And I'm really grateful to have someone saying out loud how proud they are of Fatima, because we just met and I'm already really proud of her. So seeing someone who have been with you for so long, it's amazing. Fatima, do you want to expand in anything that maybe one of your teachers have told us about? Is there anything that you want to add to her points?
If I can I have a few of my slides? I have some other points on the slides, sorry. See, she has actually said most.
I'm gonna ask Eleonora to put the strengthening, maybe the strengthening ones. So we have still 5 minutes, so we can probably go through a couple of questions as well as the slides. So I'm gonna give you a couple of minutes to share some of the things on the slides.
Let me know if this is the one that you wanted.
We already talked about the faculty and mentorship. Yeah, we need more oncology nurses educator, because even in Abuja, we don't have much of them, and we only have one other school apart from. So if we have oncology nurses educator all over Nigeria, I believe we can still do better. And I believe there should be residency program, because in Nigeria today, we don't have an oncology residency program. So I also believe leveraging digital learnings, at least with FT3, GPON, ONS, we can align with global standard. So as she mentioned earlier too, the hands-on clinical training. Yeah, we need internship programs in our cancer. We have major cancer centers now in Nigeria, and we have some other ones coming up. So if we have internship program in those facilities, I think oncology nurses will be much more than this. Let's go to the next slide. Yeah. So she already talked of advocacy. Yeah. To foster professional development and certification, she talked about that. I believe we should have fellowship. Fellowship is very important in oncology, and I believe it will make a great impact. So we should encourage other nurses to pursue specialty certification. A lot of nurses out there, it's not as if they don't like oncology, but the fear of unknown. They are like cancer, and the psychological aspect of oncology, of cancer care, the hazard of chemotherapy and what have you, it scared them a lot. But when we advocate, when we encourage them and make them see things in different ways, I believe we have a lot of hands that will help in oncology nursing. And we should encourage oncology nursing conferences, summits, and workshops. So I believe we get there. So I have one last slide. Yeah. Yeah, so I said oncology nursing must evolve with emerging treatment. Yeah, we need to step up. So, and there should be continuous learning is essential for improving patient outcome. We have to collaborate between institutions, governments, and nurses is very crucial. We can't work as an island. We have to work together, and we have to invest in oncology nursing education. Because investing in oncology nursing education is investing in better cancer care. We have to let our let me say, should I say our leaders and organization institutions that are well to do, they should invest in oncology nursing education. Yeah. I have one last slide where I talk about collaboration. Yeah, not this. Yeah, precision oncology is here. Are we prepared? Are we ready to learn more? So we should be ready to step up, and we have to expand access to oncology nursing education. It's very critical. We have to work together to break barriers and improve cancer care. Yeah, so one last slide. Yeah, there's one slide that is very important. Okay, it's not there. Oh, I missed that. Oh, fine. Thank you very much for having me here.
Oh, thank you, Fatima. I think with your words I could actually finish, but I'm not, because it's so powerful what both of you said about the enhanced precision medicine curricula, empower the nurses, that we find our voice to actually give patients voice. This is not about us. Of course, it's also about us, but this is not about us. This is about making our patients' life easier. So if any of you have any questions for our speakers, I'm gonna encourage you to participate, but we will move into the break rooms in a couple of minutes. So you will have also opportunities to speak in break rooms. When we move into break rooms, especially, I will encourage, if any of you have good connection and feel comfortable, to please turn on the cameras so we can actually see each other. But has anybody any questions for our speakers, or anybody wants to share their story? Someone had the hand raised. Okay, I have one now. Denise. We cannot hear you. I don't know if it's
I don't think she has her audio on, Celia. I can't see her microphone symbol.
so maybe has.
she's
Oh,
connected with
Denise, we
audio.
want to hear you. Please come back with audio.
Hear me now?
Yes, we can.
Oh, thank you. Mine is not a question, as I said. It's just to congratulate all nurses who became the oncology nurses. And I would like to encourage them that the journey is still there. So it's all about to be authentic on this journey. And the world is looking the people like you. We know that your knowledge and skills, if it all becomes into practice, you are going to change the world. I know this is a very big challenge that the world is facing nowadays, and I'm so happy to encourage the nurses that on putting more and effort on this, it will really, really be impactful to the life of those people, especially who are sick, and to empower, especially in the prevention measures. Thank you.
No, thank you. That's so powerful and so true. We need to keep together, and it's a very difficult world at the moment. So thank you, and thank you for the little faces that I'm starting to see, cameras popping on. This is really nice. It's nice to be able even to see you, even if we cannot meet face to face. Does anybody else have any comment, any question? I saw someone who had her or his hand raised, and then they pop it down. I couldn't catch the name, so I cannot pop you in the screen now. Akinade, and please apologize everyone if I'm not saying the names correctly, and you can tell me your name and exactly how you pronounce it and where you're from, please.
Good afternoon, everyone, or good day wherever you are hearing me from. I am Olufunmilayo Akinade, speaking from Lagos, Nigeria. I'm a cancer survivor of 6 years and counting. I've had the opportunity to meet with Fatima, and I'm glad she's speaking, not for herself today, but for oncology nursing and for cancer survivors as well. Thank you, everyone, for advocating for us, and we are glad you are putting this out for us. Thank you, thank you, thank you, thank you, everyone.
Steel machine?
Yes. Hello, everyone. Hello.
I can hear you perfectly.
Yes. Congratulations. It's wonderful to hear all of you. And you know that when we are living in a low resource country or a limited resource country and listen each other, it it gives you empower and some you can say some support that how people how nurses are struggling with the low resources and they are struggling for their education, and even like Fatma said that there is no internship or no observership or not organized oncology nursing program over there, like in Pakistan. Like I am working in Pakistan. I am Dilishan, as you know, that we have no organized oncology nursing program here for the training of the nurses, for the training of nursing bone marrow transplant or oncology or hematology. Only few nurses who are doing some of nurses are struggling to educating the newcomers. And so this is very hard for us. This is very hard for us that we are struggling with that. And when I attend this program, no, I come to know that we can do, when we are together, we are on one platform like GPON and other platforms. We can train each other, we can communicate with each other, and we can also support with each other. So wonderful meeting and wonderful speakers. So I must congratulate all of you and thank you very much. And we are on the same platform. Thank you.
Thank you for sharing. You give us so much to GPON, and we are forever grateful. And it's very difficult for us that we are, even though in a difficult world, in a very comfortable position, listening the big struggles that you go through and still give such an amazing care to patients as our patient just said. So I cannot say anything that a patient voice cannot say better. Lygia?
Hi, everyone. My name is Ligia. I am originally from Brazil, but I live in Miami. And I would like to thank you for this wonderful opportunity and presentation that everyone gave. And this is very insightful to know how oncology is taking place in different parts of the world. And I just wanted to share for everyone that's in the group that the difficulties even go in our end, even here in Miami. Like oncology is a very difficult language. Like Darcy shared, there is wonderful resources in ONS, and we have all the resources here in US. But it's difficult to learn as a language in oncology. And I just wanted to encourage those that don't understand, quite grasp everything that goes on clinical trials, either for language barriers or for, the difficult of what it is to care for the patient and keep up with the new information. Just keep searching and networking and reading, and slowly we can help each other to better help our patients, because it doesn't happen like day by day, like just to know everything. I've been in oncology for 4 years, and I read every day and I talk to people every day, the doctors, I harass the doctors, the nurses. And I can only say that by doing that, I can better help the patients and better assessing them and better caring for them. And what everyone is doing is wonderful. Just the fact of being here is you're already being ahead, because you're thinking through, you're networking, you are improving yourself to better help your patients. Thank you.
Muito obrigada, Lygia. Prazer.
De nada, muito prazer.
I just said thank you very much. Sorry. I always find a good moment to practice my Portuguese.
Wonderful.
I don't know,
anytime you want.
I don't know if Chira Tizzo wanted to speak. I don't know if it was a hand or you wanted to talk. So I don't want to put you in the spot. It just, if you wanted to speak, just to give you the space to do so.
Okay, thank you very much. Yes, I'm Chiratizo from Zimbabwe. I'm so happy to be on this platform sharing with people who are doing the same work that we are doing over here. It's so interesting that most of the issues that have been mentioned, we are also experiencing them here. But at the same time, in Zimbabwe, we do have a big training hospital where we are training oncology nurses. However, after training them, we are having a challenge of a brain drain. Most of them are going out for greener pastures, and we still have our oncology wards. They are still suffering. They are still manned by nurses who have not gone through the training, but we haven't stopped the training. We also have challenges in the training because we do not have much resources. we actually depend on well-wishers who support us. Sometimes when we want to have attachments, we need to go into non-governmental institutes where we can actually see some of the equipment that can be used, because in our public setup, we do not have those ones. So I think it is also important to empower nurses to have access to these machines, the testing machines that you were talking about. Most of our nurses, they only see them when they go into the private sector. Whilst when they are in the government where they are trained, they don't really meet these things. So I also think it is very important for our nurses to be exposed to these things. And also, we are also working hard to improve precision oncology here in Zimbabwe. We have sat down. We are only two in the department who are doing the training. I am the coordinator there. I've done education in oncology and palliative care. And I also have somebody who is also still training, but we are working together. So we thought we could enhance our curriculum, like somebody said. So we included the targeted therapies in our curriculum, and we thought it would also improve our nurses as they go out. They meet these things in the wards or in the clinical setup. They are not surprised, but still, it's only theory in the classroom, because we do not really have, like I said, institutes where we can go and really meet people being initiated on these therapies, because we don't really have them in Zimbabwe. Most of them, they go out South Africa, then they are initiated, then they come back, and they are only monitored. So I think those are some of the challenges that we have, but we are working hard. And I think education for oncology nurses it doesn't have an excuse. We really need to keep on adding, and we are trying. Like now, I've actually engaged in doing a PhD in oncology, in pediatric oncology, focusing on nutrition. So I'm trying to work towards precision, to how nutrition can be utilized to achieve precision in the management of our pediatric cancer patients. So I think we really need to work hard. Thank you.
I'm looking forward hearing results of your work.
I'm still working.
Of course, but in the meantime, let us know, send us an email, share your story. We had online someone who expressed interest on sharing his story. Mohammed Osman, I think you are in the call. I cannot see you right now. Yes, I can see you now. Would you like to share? You are on mute right now.
Good evening.
Now you're here. Yes.
How are you? Hello, everyone. Thank you, everyone who presented the listed webinar. I need to continue like this webinar another time. I'm Mohammed Usman from Sudan. I work in National Cancer Institute, Brazil. I want to share my story of my experience. I'm senior oncology nurse and also biotic specialty nurse. I'm working in the National Cancer Institute as a oncology nurse, and also work in like biotic care nurse. My experience, I'm leading an biotic course in Camboni, and another one in Uganda. Biotic care, international biotic care, and do as biotic care nurse from 2016 until now. My experience, do as a director of training in National Cancer Institute, me and our colleague, in Sudan, generally in Sudan, there's no anyone, especially in oncology nurse, just little one, two or more. Depend all oncology nurse depend on senior nurse. Means any senior nurse who train the junior nurse in oncology center. And this need international of training in oncology nurse in Sudan. My experience, where train the senior the junior nurse by doing clinical round, clinical nurse in the clinical round once per week, and also sit around, and also like case study, and also training who to know about chemotherapy or radiotherapy steady action or radiotherapy side effect. This is for junior nurse, and also train the junior the nurse who work in another center in Sudan. Train about 7 or 8 group of nurse work in another center in Sudan, like Darif Oncology Center or Sudan Oncology Center, or Marawi or Somalia Oncology Center. And also train the volunteers in palliative care. Me and our colleague train about 39 group in volunteer, as a volunteer in palliative care. On our turn, first, first cause let me our let my group or my team in palliative care to train this volunteer to suffering of patient, like train in wound care or colostomy care or laparoscopy care, because some patient travel for area to our center is very suffering for who to need to support the patient, because some patient came from big area because and another financial problem. This is an aim of palliative volunteer or volunteer palliative care training, and also training as a health professional palliative care. Train me and our colleague in professional health provider as in palliative care, and also train the student in university in palliative care or in clinical area. And this is my experience. Thank you.
It is such a challenge for many people in Europe as well, that we are working with oncology patients in many occasions without the training, and we still do so much. So thank you very much, Mohammed, for sharing your story and for volunteering, you even from the email to share. We're gonna move into break rooms, but before we share the screen, I'm gonna ask whoever feels comfortable to please open your screens, put a big smile so we can do a community picture moment, so we can capture this amazing discussion that we have been having before we divide into other different groups and we got into deeper discussions on how we can make it better.
Okay, I see
Thank
there are
you,
more comments
Lenora.
coming on. Can I have another smile, just because I saw that there is one more beautiful face that we can capture? Everyone smile. There we go. Let me get to page 2 as well. And one final one, just to make sure that we are not missing anybody. Here we go. So I'm sure, and I'm gonna maybe Celia continue and quickly explain about the breakout groups if you want.
Okay, so I'm going to explain about the break rooms. So what we are going to do now is continue something similar to what we have been doing just now. We are going to divide in different smaller groups so people may feel more comfortable to share, to discuss how we can actually, how can we make some of this education, or even taking the examples from our speakers or other examples that you may have, how we can make this education more accessible to everyone. Ideas of how have you felt by listening to the speakers that we had, or what support you need to make this education in practice. So you don't have to do anything. You will be automatically sent to another group where you will have one of the speakers that were with us today, and you will also have one member of GPON and one member of FT3 that we will support and facilitate this discussion. We want to know ideas to continue this work. So strategies for this education in precision oncology. What can you learn, or what can you think you can use? What support you needed? And also, if you have any other good case practice, please share so we can actually, you have maybe good speakers that you want for future, or you have good resources that people could use or that we could adapt to another languages. So you will be put in a room, and then we will be using this form. You don't have to use it if you don't want to, but we will be sharing a link. Well, we will be writing the answers, but you don't have to worry about this. You can focus on the discussion because it will be the supporters, the one that we are more engaged into writing down your ideas. So get lost in the conversation. We will have around 20 minutes in the discussion. Then we will bring all of us back to kind of share all those big moments that we had in our little groups, and to think about future and explain to you as well what we are going to do in the future. So please bear with us for a moment while we put you in different groups, and we will see you on the other side. Before we share, I'm gonna use Julia's brain. So I'm gonna ask all of you to, if you don't feel comfortable with English and you would like to have either things translated into another language or the resources translated into the other language, just write on the chat what language would you need it in. It's not that we are going to be able to do it. It's just to know what languages are needed. So we can think about that. So thank you.
Be Spanish there.
Yeah.
In the meantime, maybe Celia, we can ask the moderators of each group to share a bit of their insights. I let you also moderate this piece, and then I jump in for the rest.
So that will be great. And so I'm gonna start with the groups that I was not part of. So Darcy, would you like to maybe share with us a little bit of what was something that really touched you? Something that in FT3 they call it your haha moment.
Thank you, Celia, and to Julia and Oziama and the other members that were in our group. I know Dilnasheen was sharing and we got cut off, so I apologize that it happened, and also Naomi. I'm not sure if it was so much of an aha moment, it was just like an uh-oh moment, if that makes sense, in the sense that we really need to have resources available, education and training for the nurses. Also, and just back to the beginning, if there are some basic courses and that can take us to where we are in precision oncology, and just to become more, educated and aware, so we're able to share information with our patients. And also maybe having bite-sized education. And I apologize to everyone, I used the term huddle cards and Julia reminded me. Many people probably doesn't know what that
I
means.
didn't know what was that. I saw it on there. I was like, what is a huddle chart?
So I'm so sorry. What it is just bite-sized education that started, with us during the pandemic, just to make sure we're all on the same page as we were providing care to our patients. And it was who's taking care of what, and sometimes we just had education as to this is information about, genomics, the difference between germline and somatic. And it's just a one-page piece of paper. So maybe that would be the starting point for precision oncology rather than all of the information that I shared. I mean, that could be like the all of it that you have, but maybe starting small would be the beginning. Also, Julia, anything to add?
I think we were all, if we could all share any resources that are free in basic oncology nursing online, maybe offline too, because sometimes people live in countries where internet is not stable. But also I'm going to throw a challenge to the FT3 folks, maybe a small primer on concepts of oncology and cancers that apply to precision medicine. So like a beginner module, a little tiny one, and then maybe one that you then start to go into precision medicine and how that applies would be fantastic resource for our friends, because they're saying that without the basics, it's hard to make the leap into precision medicine. And I think we shared an article I found, I'm going to put it in this bigger chat, that is the role of nurse. This is a free article. This is where you can download the PDF, the nurse's role in precision health. And this might also generate some ideas in how you as a nurse can, this is from Nursing Outlook, a group that we know, a publication we know, but just to see how, if this is new to your setting, how you might be the person that leads that. And I don't know how open FT3 is to getting emails, but are you asking for feedback from the yeah, okay, so you're asking if you have a question, if you have, this is something that really is important in your setting, feel free to contact this group. Maybe somebody could put an email in here to ask questions going forward, because it's a group that's developing, and I think you can see by today's presentation and the one we had in December, we want to hear from you. We want to know what you need to see if we can fill that need. So please tell, do you need material in Arabic? Do you need it in Swahili? Do you need it in Portuguese? If you tell us on this chat, we will save this chat and we will know what languages would you like to be able to teach your patients, to your other nurses, in your setting. It'd be great.
Thank you. I'm very aware of the time, so I'm gonna try to bring one thing that's maybe Fatima, one thing that has really touched you from the conversation that you would like to bring. I think Annie was with Fatima, so Annie and Fatima.
Fatima, can you go first, or is Fatima not there? So we talked about lots of different things in education, and we felt very strongly, Fatima, no? We felt very strongly that we could learn from our patients best of all, and if we could get access to the patient advisory groups, the advocacy groups that FT3 had, and learn from them and join up a wee bit with our patients. We thought projects, if we focus down on one project, all of us, that would be good, so that you really feel engaged as well. What else was there? We talked about experiential learning, and maybe from GPON, we give lots of opportunities, maybe to, for a travel fellowship or whatever, to learn on the job. And many of our nurses said they do learn on the job. They haven't been trained in oncology, but they're working with cancer patients and care for cancer patients, and they're learning on the job as well. So that was some of the things we thought. We all had smiles on our faces. Everybody talked eventually when the networks worked, and we just thought sharing stories was the best thing ever. So we've heard all of that today and in our group as well. Thank you. Fatima, I'm sorry. Are you there? Yeah, on you go.
So actually, Anya has already said all we talked about. People, all nurses are actually interested in learning. So in learning, we need to share resources and help them leverage how they can learn more from other institutions, especially international organizations, sponsorship and scholarships and collaborations. So that was one lot.
So we are 1 minute to go. So I'm gonna be very, very rude and said, Halima, Liliana, one word.
Collaboration.
Thank you, Liliana.
Halima.
Engagement.
Thank you. See, one word works. So, Eleanor, I think you want to share slides, just to say the final goodbye and leave you with hunger for more.
So we just wanted to make sure that you're aware of the next steps and give you a way to reach out to us if you want, give you a way to start exploring resources. So we wanted to invite you to join us to our next touch points. My colleague Sylvia will share all the links in the chat in a minute. So there is an FT3 town hall coming up on April 23rd. There is a multi-stakeholder touch point where we focus on the topics of precision medicine. So it's not only precision oncology, it's not only nurses, but you can hear a bit more about all the initiatives that FT3 does and maybe connect with our network and also get to know the people that actually supported FT3 getting engaged into supporting the nurses community. So we would love to have more of you there and even have more nurses advocating as Celia does within the community. Then we also invite you to check out the PIOF virtual sessions. As we shared in the beginning, there was a multi-stakeholder dialogue run in February that allowed us to get patient expectations onto how nurses could support them. If you enjoyed or if you enjoy in general this kind of multi-stakeholder co-creation activities, we would love to have more nurses involved and we would love to have more nurses represented in all patient engagement topics. So I would invite you to check out the page of PIOF Virtual and register to any session that is of your interest. And last, but maybe most importantly, save the date for our next GPON and FT3 community of practice for nurses. I and my colleagues noticed most of you have a lot of stories to share about advocacy. So I'm super happy to share that our next focus is going to be advocacy and advancing the potential of nurses to advocate, hearing from you. As for this session, in the registration form, you can let us know if you would like to speak. Because we are 2 months in advance, I'm going to let you know if you register now and let us know if you would like to speak. You may be acting as one of the main speakers as Liliana, Fatima, Alima, and Darcy, and we would love that. So please register, save the date, and we'll share more info with the broader community soon. But because you're attending today, you already get to register, even if the event is not public yet. Last but not least, here's a slide with a few resources. We'll share more of the resources that are available. And please fill the feedback form by April 30th. It's very quick and you can use it to let us know all the things that you would like to see. How was this session? How can we improve? What would you like to see in the next sessions? How can we make it your platform really? Also, the feedback form will give you access to an attendance certificate. For those of you who attended the first workshop, please, just for you to know, your certificates are underway. We did not forget. We just took a bit to process them, but they are almost there, so you're going to get both of them together. So it's still on our radar, it's still happening, will still happen. Just fill the feedback form, please. And just for you to know, we're also working to make these meetings more accessible. So we may be coming soon with more tools that allow us for translations. We know Zoom captions are not always accurate. Thank you for being patient. Let us know what else we can work on to make these meetings together. And thanks again to all of our speakers and to Celia, of course, for initiating this partnership and for moderating so beautifully. And thanks to all of you for joining.
Thank you for an amazing session.
Bye. Thank you so much.
Thank you so much.
Brilliant. Absolutely brilliant.
Bye-bye.
Bye.
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 Bye. Thank you. We'll close the meeting for everyone now.
Yeah. Thank you,
Bye,
Leonora.
everyone. Thank you.
Bye. Thank you.